So we have our little our little mantra here: stop guessing, start assessing. And this has really been a major theme for us at Classy as we've put together our program. We've just seen the power of having careful, comprehensive assessment for children and for the families to understand their children and adolescents. We'll be going into adolescence as we move towards some of the new tests that we're using, and also with adults. So I hear often from therapists, well, we don't, we're only allowed 20 minutes or 30 minutes for an assessment, and a lot of rules that it seems that therapists are given about the time that they have for assessment, which assessments they can use. And I'm always a little struck by that. So I just had this example about, what if you went to a doctor and the doctor told you that she only had 30 minutes for an assessment, and you went to the doctor because you had a sore shoulder, you had some pain. And so what if that doctor told you, well, I only have 30 minutes, that's all I'm allowed. I'm just gonna take a look. Here, fill out this checklist, and we'll just try some things. Maybe we'll try some pills. Maybe you have an infection, so we'll just give you a few antibiotics. Maybe we'll do a little surgery because it could be something that requires surgery. I'll put you in a cast, and we'll just go ahead and do some chemotherapy because maybe it's cancer. We're not really sure. We don't have time for a full assessment, so we'll just try a few different things. And we wouldn't be okay with that if that was our own health and program, but we do somewhat of that in sensory integration, and we can get away with it in sensory integration because we can be fun and we can keep the children happy and engaged, so we can get away with that kind of throw it against the wall and try whatever we may. We can get away with a little more than maybe a physician would be able to get away with trying a little bit of pills and a little bit of surgery. That probably wouldn't fly for long. So the point is that we don't want to have our practice run that way. It's not good for the children and families that we're serving, and it's not good for our professions. We want to be much more systematic and methodical in how we provide our services.